Welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombiewski, nurse practitioner here at RevitalyzeMD. And today we have a podcast by your all's request.
Back by popular demand. So PT-141 or Bremelanotide. So that is what we're going to talk about today, and all the things, the questions, like how it works, what it
does,
who can take it, who's
how
right
you get
for
it.
Yeah. And all the details of it. If you like content that gives you a better sex life, or you and your partner or your significant other, then you need to like and subscribe so you'll get notifications of our podcast. PT-141, otherwise known as Bremelanotide. So we learned a lot today, even that we didn't know. And so again, we'll go in deep dive into some studies and research and history, but the history of this is very interesting. It was like a bad murder mystery. You know, we just went one detail, putting it all together. What is PT-141 or Bremelanotide? What we're talking about is a melanocortin hormone. Mm-hmm. And these hormones are multifunctional peptides, and peptides are small amino acid sequences. They're smaller than 20 amino acids. That would be a protein. So these will simulate something such as a neurotransmitter or hormone in the body. And there are melanocortins will stimulate melanocortin receptors, and there's 5 receptors, and they have different effects in the body. So it depends on what receptor you are stimulating, what kind of effect you're going to get. So, and they're acting like a melanocyte stimulating hormone. So basically, and I would love to go into the history of that then.
Yes.
Because how did PT-141 come to be?
As early as the 60s.
Yeah.
Yeah. So scientists were looking at this back in the 60s. When you think about that, that's how long these peptides have been around. Yeah. So it started out looking at the effects on skin, right? Isn't that where it came from initially, looking on how to affect the melanocytes?
Yes. There were some developers in Arizona, the University of Arizona, I think, but maybe not exactly there, but one of the, labs in Arizona, and they were developing alpha analogs of melanocyte stimulating hormone, or MSH. And they did that up to the 80s.
Yeah.
Started looking at melanotan 1 and 2. And again, if you haven't seen our melanotan videos, there's a good link to this development of melanotan 2 in that history, in that link. Up to the 80s, they were looking at melanotan 1 and 2. And those are tanning peptides. So they act like, again, melanocyte stimulating hormone, which goes and stimulates melanocytes in the skin and increases melanin, which has tanning effects. And so increased pigment in the skin. And then what happened to the one scientist, Faraday? He went overboard. There's always one that has to go overboard.
One. Yeah. He gave himself 2 times the dose of everyone else because, I guess, you think why not sometimes.
More is always better, right?
It seems to be sometimes anyway. But he ended up with an 8-hour erection.
Yes.
So from there,
they realized that it had an effect on
sexual function, sexual behavior,
and erections.
Absolutely.
So basically, if you're looking at melanotan 1 or 2, and melanotan 2 is really the one that you're looking at now, that acts on a certain receptor, and it's like receptor 1 or 2. And that affects tanning. And then what would happen is now they were looking and breaking down at the specificity of other melanocyte or melanocortin receptors. And so 3 and 4.
What actually caused
the erection?
That erection?
Yeah. So 3 and 4 are the receptors, and 4 actually has everything to do with male sexual function or erections.
And sexual behaviors.
That's what happened with that. He took an extra dose. And so with that extra dose, now it was stimulating more specifically the MCR4 receptor. And so they, up into the 80s, were still looking at that. Then they sold the rights to it to Palatine Technologies.
Which now, when you look into that company, they now have an FDA approved product as well for PT-141.
So basically they brought it to market. Interesting course to market. And that's what I find very interesting about approvals, about drug company sponsored studies, how you can tweak, make things look good, and also leave a lot of stuff out. And so that's what we're going to talk about just with the history before we even get into more actions with PT141. And remember, we're going to get into all of it, how it works, who's the right candidate for it, what kind of side effects, how you can get it. And so, but anyhow, when Palatine Technologies got it, they stopped the development of melanotan too. So the tanning peptide went away because what they saw was value in the erection technology, right? So that peptide,
behaviors.
Yep. Yeah. So basically affecting erections and sex drive was basically the focus of a very smart drug company, right? Because again, that connects us all. And so if we can bring something that helps with sex drive and connection, then that will sell better than tanning. But what happened is they started with an intranasal study that they had to stop. And so it never got any further because it had increased blood pressures and
decreased heart rate, nausea, flushing, just all the side effects.
So too many side effects. And so they had to stop the study. So instead, they went ahead and resubmitted a study with injections.
They shifted gears.
Yeah, they definitely. And think about it. How do you shift from a intranasal, which seems like it would be safer, to an injection and then bring it to market? But it happened.
And as an injectable, we still have increased blood pressures. We still have decreased heart rates. We still have nausea and flushing. So we still have all those potentials of all those same negative side effects as you do as intranasal.
Well, we can even go further. So Vyleesi is their manufactured brand. So that's the FDA approved brand is Vyleesi. It is only FDA approved for hypoactive sexual desire disorder with women.
Premenopausal.
And premenopausal. So not even postmenopausal, which is a huge issue for postmenopausal women. And
nor for men.
Yeah.
Just women.
Yeah, no. So just for women, and interesting course there as well. So basically in those studies, at least in one of them, again, say they started with like 1,200 patients to start. So 1,200 patients, around 400 or so dropped out of the core initial study. So the phase 1 core study, 32% dropped out. So, 68% finish it. And then they have a phase 2. So of those almost 70% that finished phase 1, only 80% of those agreed to go to phase 2. And then only 40% of those
80
completed the full phase 2. Very vague about why they dropped out. Definitely no, like only 1 to 1.5% serious adverse reactions. But it doesn't go into exactly, all the details of how many side effects, but there were a huge amount. And it was nausea and flushing and high blood pressure and all the things. But the conclusion of the study was that it is good for increasing, arousal and libido and orgasmic strength. And they didn't gain anything with the extension in phase 2 that they didn't have for phase 1. Now, having said all that, we love PT141.
Yes.
But I mean, if we're going to look at the facts of how that came to market, it is a very kind of tweaked, course with lots of side effects. And then if we're talking about things such as Gaines wave or laser vaginal rejuvenation that have lots of, studies looking at that with no adverse effects.
Negative side effects.
And then yet we can't get anyone to safely say without longer term effects. And we have up to 2 years, with Gaines wave, for instance. So that's where I just think it's interesting to look at 3-letter agencies and approvals. And then that study was actually funded by Palatine Technologies, surprisingly. So it's amazing to me that if you look at who funds, it never used to be that the funding and studies would be so influenced by drug companies, and then the results be influenced and tweaked as well. So I think that it hid a lot of side effects that are potentially there. So you need to know when you use PT141, nausea and flushing are
nausea
huge.
Was the big one. It was 40% of patients had nausea.
And had to take medicines for it.
Yes.
Right? Yeah.
Well, it was even like a higher percent for long-term use ended up on like a Zofran.
It has issues, but I think that everyone loves it. Now, having said all that, we're saying it just to point out that when patients are looking for an FDA approved, and we're talking about drugs and surgery, that isn't always the best approach if you can regenerate with little adverse effects. And so this, we feel like, is an enhancement to hormone optimization, because if your hormones are low and you want to optimize,
yes,
that's really
if
the
you've
starting
watched
point.
Any of our videos, you know that we believe that hormone replacement really is the core for the majority of our patients. It really is. Everything else is the icing on top. This is just one more way to attack sexual wellness. One more tool that we have that we can utilize to increase libido, that sexual desire, to help with erections, to help men and women both alike reach, their goals in the bedroom.
Yeah. And reconnect, because we have different ways that we change and different things that we notice as we get older. And so reconnecting in those ways and bringing couples back together. And I think that it's part of a comprehensive plan for sure. And hormone optimization, if your testosterone is low, you're going to have changes as you age, and all diseases start as our hormones drop and inflammation in the body happens. And so, you need to optimize that. So looking to PT 141 to correct erection issues, if you can hardly get an erection, is probably not going to work alone. You're going to have hormone optimization and be willing to have those discussions about it.
Or regenerative.
Yeah, or regenerative.
So I'm going to repeat that because this one's really important, is that if we do not have function, right? We are taking the Viagras, we're taking the Cialis, and we are having a hard time getting and maintaining an erection. PT 141 is not going to do it on its own.
It's not. Yeah, it's just not, right? Who's looking for this? It's men or women with low sex drive and men or women with low orgasmic strength. And so if we look at hormones, that plays a huge role. And if you can have a hormone evaluation and it's found not to be contraindicated, that's the core. And then we would add this too as part of the comprehensive. But we're talking about regeneration with comprehensive stuff. And as we get older, blood flow is an issue and a significant issue. Who is a candidate for it?
So when we look at FDA approval, right, we know that the FDA medication that's out there is for premenopausal women. But when we look beyond that and how we actually prescribe and who benefits from it, we see it across the board, all women with low sexual desire, pre, post, all ages, and then men as well.
Mm-hmm. So low sex drive, you can definitely benefit from it. Yeah. Again, we feel like it's a part of a comprehensive plan. So seeing somebody that specializes, or an office that specializes in sexual wellness, is important because it's part of a comprehensive plan, but another tool in our toolbox for it. So
Viagra, Cialis, they're going to work on relaxing smooth muscle, helping with blood flow. They're going to work very differently than this medication. This medication is going to work through neurological pathways to increase desire, so make you horny.
And when we talk about that melanocortin, and melanotan stimulating hormone, we're talking about brain, so in the hypothalamus production, and then basically the pathway that stimulates in a different way, but it's not a blood flow and it's not increasing. The vessels aren't dilating, and those organs to increase blood flow and strength and function. Instead, it's coming neurologically. So might also give a man more confidence back, because obviously as we're losing erections with time, we're losing strength, consistency. That hugely affects us psychologically, or affects men psychologically. And so that definitely improves that, because you might get spontaneous erections that you weren't getting before and aren't getting with the PD-5 inhibitors like Viagra and Cialis, right?
So desire is going to help erectile function.
And so for a moment, maybe rewind and say, what are the traditional treatments that are offered in medicine right now to treat ED? So if you are losing strength of erections, you're losing consistency, you're not getting morning, you're not getting nocturnal, your confidence is affected, what are your treatment options now from your doctor, from your urologist?
What we hear from patients is, they gave me Cialis or they gave me Viagra.
So the pill.
They gave me a pill.
So the little blue pill.
But then on the women's side of it, most women say, my doctor told me it was part of aging.
Yes.
that this is normal.
But they also can do the little blue pill, and there's low doses of that. And now the FDA is actually coming out and saying that it's anti-inflammatory, anti-aging, but that's been around for a while. Mm-hmm. And we know that. So you can do daily Cialis low doses, men and women. So women can take those agents too. But what are another option? So yes, the pill medication, you have injections. So you can do something that increases the vessel wall with injections like Trimix, for instance. So you're vasodilating with an agent that you're injecting.
Testosterone, depending on what physician you see.
Yes. Yeah. So that's highly dependent on who you're seeing, because they may say you're normal. And again, if a range is, say, somewhere between, 250 and 900, just to estimate, and you were 900 and now you're 300, you're still normal. And so optimal would be the key. And then those other two also are dependent on timing. So you have to have timing of your pill or timing of your Trimix, so that spontaneous erection is not there, that flow and just spontaneity. And then penile injections, or not injections, implants. So implant is another one. And erection devices, vacuum erection devices. So we're looking at drugs, surgery, implant, injectables into your penis, Trimix. And again, nothing that's going to regenerate or solve, but it's going to help, temporarily with timing. Testosterone. So optimizing, but that's an if, because that's not going to be offered by all traditional doctors. Yes. And then you have a vacuum erection device, which I would love for somebody to drop some comments on what their experience has been with vacuum erection devices, and if it's helpful, if it's giving you erections back. So,
and that's for the guys. Now for the girls, what do you get for traditional medicine?
It's a good question.
Right?
You pose good questions.
Yeah. Yes, so what do we get for the women when the women go to their physician and say, I have low sex drive, I have low desire, I'm having these feelings, what is going on?
Or the two big things. I have low sex drive and my orgasms are no longer there or decreased. Or I can't have one. So those are two big complaints. So again, if you have a significant other, your wife, your girlfriend, that hasn't heard about solutions for women, definitely you want to tune them into some of our videos, because there's plenty out there.
Because there isn't in traditional.
What do they get though? There's plenty of solutions you're not getting offered it by your traditional doc. So what are they
occasionally offering? Estrogen. I have even younger women that are given creams or pills.
But it's really...
but it's nothing.
Yeah.
There really isn't any great solutions in traditional medicine. So most of the women we see in this office are extremely frustrated because they've seen their primary, they've seen their GYN, they've seen an endocrinologist, they've seen, you name it, a list of everybody. So a lot of times in traditional medicine, they're going, well, let's see if, they don't answer the sexual wellness side of it. They go, oh, well, let's look at your labs and see what your hormones look like. But by hormones, they mean their estrogen and their thyroid.
That's if they get there.
If they get there.
Yeah. And then when they get there, it's a couple hormones that they default to, for sure. And so again, there's a gender bias for women, 100%. So there's low T clinics for men. There's not low T clinics for women, but it is the most abundant circulating hormone in a woman's body too. And we need that it's an overall well-being life force for women and for men. And testosterone is the issue. But even when hormones are done, I would say still like 95% of the time, it doesn't include testosterone when they come to us. And patients are more proactive than physicians in this area and providers, because they want solutions. And they're quite frankly tired of being told, for women, that there isn't a solution and that's normal when you're aging, and they come in tearful. So this is why this drug was brought to market, because so frequently when we were reading and researching about this, it will also say that women have low sex drive for an unknown reason. An unknown reason as they're perimenopause, premenopausal, or postmenopausal, for some unknown reason. So we're going to try and help it, where birth control will lower your sex drive. It binds your testosterone that younger women do have. And so that's an issue.
Some antidepressants.
And we're going to talk about, there'll be another video that talks about low sex drive and like the stats in women, but it's amazing. And again, hysterectomies, and the earlier they have them, the worse it is for lowering their sex drive.
But that's how medications like PT141 come about.
That's how, because there's no other solutions, but testosterone is an optimization makes a world of difference. It's life changing. So, but again, remember this one is something that, again, if there's not a contraindication, and there really hasn't, like, again, high blood pressure was seen, if you have some GI, you can get nausea. Almost everyone loves it once they use it. It depends on the timing and the side effects. So you have to acclimate to the side effects.
Yes.
It's higher with the first dose. So nausea tends to be higher with the first dose. The higher dose it is. If you have erectile dysfunction, you're going to tend to go higher doses, but you do acclimate to the nausea. You don't want to take it for a special occasion, because if you do, you might get nauseated on that special occasion. So you want to try it out first, and then timing. Could be 30 minutes. It works for you. It could be
2 hours.
Yeah. Or 5 hours even.
Yeah.
Yeah. So you got to get your timing down, and then it can last for quite a bit of time. And again, that's variable, but potentially, 24
48
to
hours.
48 hours. So yeah. So you don't want to dose it, but every 72 hours. And
I would run review from a female that had said that it lasted a good 3 days for her.
And again, I think that women were responding, but there were a lot of side effects. And so, that's what you want. But that's the other thing about the FDA approved is you also can't adjust it. It's in a single dose. And that dose is a higher dose than you might need. So it's a one size fits all, 1.75 milligrams in a 0.3 syringe. Quite pricey for the one dose. Might last, but you might get side effects and you can't adjust it because it's a single syringe. But I do feel like you would love it, and again, it is going to enhance the icing on the cake is what Faraday said, I think. I agree with that.
So this is an injectable. It is one that you inject first, and then you can repeat your dose if appropriate. So there is a sliding range of doses. It's not a one dose fits all, as Dr. Durst said. So you want to make sure that when you are seeing a provider and this is getting prescribed, that they're prescribing it based on your needs, and that you understand that it is a sliding scale on dosing. That dose varies significantly person to person, so we will not go through that. That's something that you need to talk with your provider about because it varies so much. Awesome. We talked about the side effects, the biggest being that nausea, but ginger and B6, great for nausea. Zofran if you need it, right? But we don't want another pharmaceutical medication if not needed, but it seems to be probably the most common side effect. And it's for both men and women, so both genders get to benefit from this.
And I really do think, again, not a one size fits all for anything. So comprehensively being addressed, medical history be taken into effect. And again, how is your sexual function to start? Do you need regenerative stuff? Do you need hormone optimization? And Faraday's absolutely right. Like, we got to take all that into effect before we would dose it. So giving you dosing isn't appropriate in a video to everyone. So you definitely want to talk with an office that does exactly what we do, which is sexual wellness. And
I know you guys want to know that, and we'd love to. If it was an easy one dose for all, it would be a very easy thing to tell you guys, but because that's probably one of the questions we get the most often. But it varies significantly.
It also depends on what your vial concentration, what the milligram of the powder is. It depends on how you're reconstituting it. So we would have to be prescribing it also to know the concentration ultimately, and then therefore what kind of volume and dose you're giving. So it gets complex for sure with peptides. And you want to go to a reputable source for sourcing of peptides because purity matters.
Yeah. And this is a prescription medicine.
Yeah.
So we had comments on that on one of our videos, and is this an over-the-counter? It is a prescription medication, so it does need to be prescribed.
And it can be given in a nasal spray, and some of them do combine with B6, so it depends on the compounding pharmacies. Compounding pharmacies aren't a bad thing. Compounding pharmacies are awesome because they can customize medications for you. They're all FDA approved, with FDA approved, sourcing. So it's just that they're not actually FDA approving every single product that's compounded, but the overall source, the pharmacy is, and they have to follow guidelines and are inspected, all the things. But again, PT-141, the sex peptide for better sex. So it does work for men and women with low sex drive and low orgasmic strength for either one of those. And it is very well received by patients once they get used to it. And so if you want to learn more, then we have multiple other videos on it. Definitely leave comments. We try to answer questions and address questions with other videos if we can, and leave us your experience if you've had it.
That's what drove this video, is your guys' questions.
So we love the interaction. Like, subscribe, share with friends, and let us know what you want to hear more of, because we are willing to deep dive into anything sexual wellness, and aesthetics as well. Thank you.
Thank you.